So I have read a quote which is which very touches my heart, and which is also which is also a personal experience of mine to a therapy. Like, you can imagine a picture that you are trying to assemble some IKEA furniture without the manual, right? So it gets frustrating, it gets confusing, it gets like you don't know how to exactly fix all of those parts to make a perfect furniture. But if you have a manual, right, if you have just a manual, you will be easily able to fix this furniture, and you will be able to fix that furniture, and you'll see a beautiful furniture there. So I feel like therapy is something like that, where we get a manual from a therapist and we are able to fix our furniture by, like, it's a manual from therapist perspective which we can get, and we can fix our furniture. And understanding the importance of it's a game changer for me, like from my personal experience of therapy.
So there are different approaches in therapy, right? Let's start with that. Why am I talking about it? Because you talked about manual that helps you to understand your problems better, and you can maybe find a better solution, right, through that manual. That is very true. But that is one part of it, right? If let's say I talk about my experience, I am trained in psychodynamic approach, which is one of the approaches which tends to understand the history of the car, right? Who made this car? Why did they make it? Right? What led them to make this kind of design? Right? What was the geopolitical scenario while this car was being made? Right? So you'll understand that the car's essence is not just its body parts, its engine, but why it has been made. The importance of why, right? That it gives you a better sense of meaning and purpose, right? And that's what marketing companies do, right? They tend to make you sell this car by touching upon your emotions, that this car was made in India by some Indian people, it's our own country's product, right? And we need to be proud of it. So you will be a little more attached with the car because it has some personal meaning. Right. Now, after understanding about the car, right, now fixing becomes easier. Right? Why do you want to fix it? Right. What will help you? Right. And like you talked about the manual very correctly, it has a lot of better ways of fixing it. So usually we don't learn these things; we do it by trial and error. Right. And sometimes the error becomes too frequent that we become helpless. Right. And that's one way of approaching in therapy. So I'll talk about different approaches, if that's okay. One is into let's say psychodynamic or humanistic. These are all approaches where psychodynamic particularly deals with understanding the root causes. Right. Why does this happen? Right? Why do I get anxious when I see my authority figure? Right? Why do I feel agitated? Why do I feel low when I have to confront someone? Right? Or why do I become paranoid when I see my neighbor? Right? Why does it happen? Right? Psychodynamic, it has one approach which is psychoanalysis, which is a very traditional, which started by Sigmund Freud, very beginning of psychotherapy, I would say. Then came in the similar approach, there was something called existential approach, which is not the time period I'm jumbling, but it started in late 60s and 70s, right? But it has some root causes in philosophy, right? Again, the human behavior, why does it happen like this, right? Why do we do this? And then there is another set of approach, which is a behavior therapy approach, right? Or cognitive behavioral therapy approach, where we are trying to understand the intricate relationship between thoughts, emotions, and behavior and our physical symptoms, right? It deals with what you said, understanding the manual and fixing it better, right? And that is what one approach is. And I like the fact that in India, we don't just get trained in one particular approach. We don't just use one approach. We use something called eclectic approach, which is a mix of all the approaches, because sometimes maybe this technique helps the client. So I borrow it, like let's say from psychodynamic. Sometimes I borrow one technique from, let's say, cognitive approach. Sometimes I borrow it from, let's say, humanistic approach. Humanistic approach deals with client-centered therapy. So client-centered, the name itself tells us that the client is important, right? The symptom is not important. The symptom is just a response, right? The client is more important. The whole person that you are, right? What has led you that in your life, what has happened with you in your life that has created this symptom, right? And it deals with a lot of empathy, a lot of genuineness, right? A lot of unconditional positive regard or accepting the client, right? And this itself makes the client feel that, I am important, my symptoms are important, so I need to learn how to deal with it, because my life is meaningful, it has some value, right? So different approaches, I would say, in therapy. So this is one of them that you mentioned about the manual. It's a beautiful example.
So there are times when an individual doesn't know what problem they are exactly facing, and like there are times when a person understands that they are facing some problem, but they don't exactly tell you. So what kind of approaches do you do at that time?
Before using any approach, I just try to understand why they are here, right? What brought them here? If they don't know what the problem is, I just simply ask, what brings you to therapy, right? And whatever they talk about, let's say they start talking about, recently I had a breakup, or recently I had a new job and the people are not nice, or recently I shifted to a new city. They start talking about the current scenario, right? Which helps me to understand what their life looks like right now, right? But I don't jump to any problem like, oh, this is your problem. Like, no, let the person speak about what they're saying, and let them come to the conclusion that, this is something that is bothering me, right? So, the easy way to explain how to identify a problem is that I look for things in the client that bothers them, and they want to talk about that, right? Because in therapy, my concern is not about something is going wrong in the client's life and I need to fix that, right? If the client says, I am in an abusive relationship, okay, but are they here to talk about that? Is it something that bothering them, right? If it doesn't bother them right now, or let's say if they don't want to talk about this, they have some bigger issue, maybe they have some more important issue currently, right? Then they want to address that first. Let them come to that, right? But identifying a problem is I understand, a lot of people might not know that what is wrong, right? But that's the thing, people always look for what is wrong, right? Instead of what is bothering me and how can I try to understand it better, right? So one approach that I commonly use for most of my clients, I would say, that is self-reflection, right? Self-reflection gives us a better understanding of our own emotions, right? So if let's say I do something called take 5, okay, whenever I come across any kind of problem in my personal life, or I see my clients going through something, I ask them to take 5 minutes, go somewhere, maybe alone or some safer place where there is no distraction, right? And just try to be with your own thoughts, with your own emotions, right? Don't do anything. Whatever thoughts come to you, let them come, let them flow, right? Whatever you feel, if you feel like crying, just do that, right? If you feel like shouting, shout them, but take 5 minutes, and whatever response of your body needs to come out, right? Just let it be like that. And then once you are calm, then only start reflecting what happened. Okay, it's like you don't ask a child what happened while the child is crying, right? You first calm them down, and then like, okay, now tell me what happened, right? So take 5, like let your body have the response that it wants, right? Sometimes we don't allow ourselves to feel certain emotions just because they don't seem correct, right? So I always encourage my clients to take 5, like always, like take 5 and just go alone somewhere aside and just be whatever you want to be right now, right? Don't worry about someone watching me, because no one is watching you. That's why I made sure that go somewhere where no one is interrupting or distracting.
That's like, it's like let your thoughts come out, so you'll get a better idea about what is troubling you and what is something that is bothering you. So how do you track the progress of therapy? Like what are some key indicators of improvement or positive change, or like what are the things you see in your client? Like how do you track that?
Okay, if I have to talk about, like, this is a two-way approach. One is you can track your progress through very typical paper pencil, where you are using certain questionnaires, right? Or let's say some assessment tools, right? Either in terms of feedback, either in terms of some reflective questions, like before the start of therapy, these things were bothering you. Like I'm writing it down as a client. These things were bothering me, and now maybe a few of them exist today, right? Or I can use a different set of approach, which comes through self-reflection frequently. That, let's say for example, when I'm anxious, I usually bite my nails. Now I'm anxious, I don't bite my nails, right? A very small change in your behavior which you have not worked on consciously, but it just happens that now you have learned to deal with your anxiety in a better way, right? Or let's say, usually when I'm angry, I shout at my sibling or at my friend who is weaker than me, right? But now, if I'm angry, I first sit and try to reflect, and maybe I talk in a more assertive way with someone who I am angry with, right? So this is a simpler, a very easier, and a tiny way to track how my behavior patterns have started showing some change, right? But also you can document it well by writing it down on a journal or something. It helps to understand and go back to that progress, that this is what I have done so far, and maybe I can continue doing that, because relapse takes place very frequently.
So how much it is important for a therapist and like a client, that how do you give any of the homework to your client and any of the exercise that you want your client to do, and what else like beyond the session, or how do you like do all such things? Can you explain any of the
I don't like the word homework. It sounds very authoritative, but if I have to give something back to the client, there are different kind of clients that come to me, and sometimes I don't give at all anything. Like I just tell them, like once they are done talking, I'm like, okay, I'll see you next week. There's nothing that I ask them to do, right? I leave them be, because I want them to take back something on their own, right? Instead of me telling them. So next time, I have a follow-up question. What feelings did you carry with you after the end of the session, right? What thoughts came to your mind about the session once you went? Or let's say, did you have any kind of different set of emotions that you experienced this week, right? Sometimes I do give them some things to reflect upon, to write upon, depending on the clients, because some clients are quite motivated and they are very dedicated to work on themselves, so they like paper pencil things, they like to write it down, they like to document it, or sometimes record their own selves, and then next time they tell me that this is what I did. Some clients prefer that, and I also use them because I don't want to get out of the comfort zone of the client, and I tell them do this and come back, right? No, it's fine. And sometimes I love this approach once, which I learned from my own therapist, that when I'm anxious and I'm talking about my own concerns, right, at the end of this, like till the end of the session, I'm showing that agitation, that anxiety, and my therapist tells me, okay Vivek, I will see you next week, right? And I'm like, but what about this anxiety right now that I'm feeling? They'll not say anything, right? They'll not say anything. They'll just be, we'll talk about it next week. We are done for today. And then this, eventually this taught me that, I don't have to always look for some solutions when I'm anxious. I need to learn to be with this anxious state, right? This is something called distress tolerance, one of the therapeutic techniques. Distress tolerance means that I don't have to do necessarily anything to solve my problems right now, right? I can just be with my problems, be with my anxiety right now, and not do anything. By anything I mean not do anything impulsively, right? Sometimes I just feel like, oh, I want to eat something sweet, or I want to go shopping, spend a lot of money, or talk to a lot of women out there or men out there, right? Or recklessly doing something that I don't need, right? Just because I'm feeling anxious. So this is a response of our anxiety. I don't need to do that. Neither I have to do breathing exercises or reflective exercise. No, I don't need to do that as well. I just need to sit with my anxiety and do nothing.
So do therapists also seek therapy?
Yes, I believe that every therapist should go to a therapy for themselves, because it's just not to understand their own problems or something. Sometimes just the experience of being on the other side, right, helps you to learn that it's not that easy. I'll tell you my experience. When I started going for my therapy, after I started practice, I've been to therapy before, but after I have started practicing, and I sometimes encourage my clients to open up, to talk about their emotions, right? When I point out something about my clients, some interpretation that I have, some perspective. When I started going for my own therapy, my therapist also started pointing out certain things, and I was extremely uncomfortable. I'm like, dude, I don't want to know that, right? I don't want you to say something, right? And then from next time, like they're asking me questions, they're encouraging me to talk, to open up. I'm like, no, I can't open up about that. It's very embarrassing. And then after the session, you get to know that it's so difficult. It's so difficult to be on the other side. Like, you can't talk about something to a stranger that easily. You need to trust a person. You need to develop that rapport. You need to feel that this person will not do or misuse any information or judge you or make you feel bad for doing such things. So like being on the other side, I used to identify, oh, this is where I became defensive. Oh, this is where I did not like the question. And it is such a refreshing perspective to be on the other side. So I believe that every therapist should go for therapy at least once in their life. If they don't have any problems, fine. But if they just want to experience the other side of it, I would strongly encourage every therapist, especially beginner therapist, to go seek the therapy themselves. And second, personal supervision and peer supervision also helps, but that is for your own clientele, your practice.
Absolutely, because what I have experienced from my experience of therapy, it's like it takes you so much to open up, but once you start opening up and once you see that healing journey, it's a beautiful journey. Like when you see that, then you feel proud on yourself as well. Okay, you are like starting healing, and it's like it's a beautiful journey when you start doing it. But when you don't do it, you still feel like, okay, what is happening? Is it good or not? You have so many questions. But when you start opening up, when you start trusting your therapist, you feel and you see that changes in yourself. So that is something which I also experienced, that you need to take that step. Okay, and it's not like you have to go directly and speak about everything. Just go there slowly and gradually, try to build that reputation, like with that relation with therapist, and then when you trust, you should be open about yourself, that what you are, because it's better to open up rather than not like just hiding yourself what you are and everything. So I extend my sincere gratitude to you, Vivek, sharing your expertise with us today. Thank you so much for taking out your time and sharing your knowledge on this topic. And thank you everyone for staying till the end. And I know like if you have any question related to this podcast, please comment on this or DM me on Instagram. I will make sure I will keep your questions confidential, and I will try to bring a podcast based on your questions, or I will try to cover those questions in our next podcast. So thank you so much, Vivek, for taking out your time and sharing your knowledge to us. Thank you so much.
Thank you, Vijay, for inviting me. It was lovely talking to you.
Thank you. Remember, your mental health is just as important as your physical health, and seeking support when needed is a sign of strength. You are not alone in this journey, and you have the capacity to lead a happier, healthier life. Until next time,
Yes.
take care of your mind and body.